Good afternoon, everyone. We're going to get started in 1 minute. Just to let you know, we are also live on our Facebook page. And so you are definitely encouraged to share this conversation on your Facebook page. We are at Facebook at CMAH, C-M-A-H. So please invite more people to the conversation if they were not able to log on via WebEx. And so we're going to post a link to our Facebook page here. So please invite people to the conversation on Facebook as well. All right, good afternoon, everyone. Good afternoon. My name is Amber Jones. I am the outreach coordinator for the Council for Minnesotans of African Heritage. And we are excited for you to join us this afternoon for our last edition of Conversations with the Council. So we are really excited to wrap up this summer of really great conversations that are going to jumpstart our priorities at the legislature and at the state in the coming biennium, in the coming legislative session. So we've had conversations this summer on education, on public safety, on economic development, and we are rounding out our conversation series today with a conversation on public health. We have some great panelists here with us today, and we just want to say thank you to all of our panelists who have joined us from across the state and across our communities of African heritage this summer. We are so grateful for your participation, for your leadership, for your continued partnership with us as we execute our mission as a council. So I'm going to take some time to just briefly introduce the council for you all if you have not interacted with us before, and then we're going to get into our conversations today. So the mission of the council, the Minnesota legislature empowered the Council for Minnesotans of African Heritage to ensure that people of African heritage fully and effectively participate in and equitably benefit from the political, social, and economic resources, policies, and procedures of the state of Minnesota. So this council is for you if you are a person of the African diaspora here in Minnesota. We are here to make sure that you are able to participate in our state system and equitably benefit from our state system as well as the resources that the state system provides. To talk briefly about our work here at the council, we do statewide community outreach and engagement work, which is largely in my wheelhouse, making sure that we are able to get the pulse on what is happening in our communities, as well as building relationships and partnerships with our residents and our constituents throughout the state of Minnesota, in the metro area, in greater Minnesota. We also advance legislative policies with a direct impact on the African heritage community. And so we work a lot with legislators at the legislators at the Capitol, especially our African heritage legislators, including some who are in this picture, including Representative Noor, Ruth Richardson, and Rena Moran, as well as our colleagues in the Senate and other representatives as well. We also advise our lawmakers and executive leadership, including the governor's office, including different state agencies, as well as the legislature. So before we go into our introductions for our panelists, I wanted to also introduce to you all and give some time for one of our council member co-hosts to give a greet from the council. And so folks may not know, but we have a representative body at the council, which includes 11 members from the African Heritage community, as well as representatives from the legislature and from the state system. So we really are grateful for the leadership of our community leaders who have taken up responsibility here at the council. And so I'm excited to introduce our council member co-host for today, who is our vice chair of the board, Wayne Doe, to give some brief remarks.
Thanks, Amber. Good afternoon. Our distinguished panelists, our viewers on Facebook and YouTube, viewing from wherever you are. I'm pleased to welcome you this afternoon, as I'm hopeful and confident that our conversation will provide insight into the kinds of work out there to help people of African heritage. Our topic today is health and wellness for African heritage Minnesotans, challenges and opportunities. I'm also pleased to be part of this conversation because it's always exciting. Our engagement with all of you can only help propel the work we do to achieve our goals and objectives on behalf of African heritage Minnesotans. You know, there's a proverb that says, he who has health has hope, and he who has hope has everything. Clearly, without health and wellness, we are already at a disadvantage, and looking ahead could be not bleaker. Today, we find our country and the rest of the world at a critical juncture where health and wellness is concerned, fighting the novel coronavirus, or COVID-19, a global pandemic. And from all indications and studies, the people of African heritage are seriously and disproportionately impacted. We are suffering the most with the onslaught that COVID-19 has caused. But I want us to be encouraged to pull our bootstraps, raise our voice, tell our stories, face the challenges head on, and let us all together explore every opportunity to advance the cause of people of African heritage. Again, I just want to welcome you, our distinguished panelists, our viewers. I look forward to a rewarding conversation. Back to you, Amber.
Thank you, Vice Chair Doe. So we will now get started with introducing our panelists today. I'm super excited to share these phenomenal leaders in our community with you all today. And so just give me 1 second so I can pull up their awesome photos. So our first two panelists, I will start with Miah Ulysse, who is the founder of Rooted Solutions. She is a fierce justice advocate and community connector with roots in Minnesota and Haiti. She is passionate about creating more just systems through policy, food, farming, and natural spaces. Miah has impacted the Twin Cities community through her work on policy and advocacy, program development, network building, and communications at organizations such as Loaves and Fishes, Worth Cooperative Grocery, Urban Oasis, Appetite for Change, and 40 Acre Co-op. She has advanced local, state, and federal food policy efforts, including the establishment of the Urban Agricultural Grant Program, one of the first urban agriculture specific state-funded grant programs in the country. Miah is the founder of Rooted Solutions, a consulting firm that offers facilitation, program development, and strategic planning services to clients who would like a fresh approach to their work. Miah is also currently facilitating the Community Equity Program, a 9-month fellowship based out of the Wilder Foundation for BIPOC folks to learn the state policy-making process. A budding herbalist and a hiking fanatic, Miah enjoys getting her hands dirty in the garden and unplugging by spending time with nature. She also makes some fire desserts. So we are excited to have you today, Miah. Our next, sorry about the typo. That says Felicia Perry. That should say LJ Tucker. And I'm just going to fix that. for us today. There we go. First slide. So our next panelist is LJ Tucker. Larry Gene Tucker Jr., who goes by LJ, believes that we are a product of our environment. Our well-being lies within the relationships we build in our community. It's when our mental, physical, and spiritual self align that we can continue to grow as individuals and as a community. LJ recognizes that growth comes from overcoming the challenges we face in our life experiences, and that we all possess the ability to guide us through those challenges. LJ has been a facilitator for youth groups and families for 4+ years and currently practices therapy with Kente Circle. He has built a trusted relationship with youth in grade school, as well as those who have been placed in the juvenile system. His goal in the youth groups are to embrace cultural differences through the desire for learning truth, knowledge, and self-identity. Working with families are also a huge part of LJ's passion. Our first support system starts at home, where the foundation for relationships begins, he quotes. LJ believes that once we are able to grasp this concept, our families become one of our greatest tools. LJ is a graduate student from the University of Wisconsin-Stout with a master's degree in marriage and family therapy. He received his bachelor's degree at Minnesota State University, Mankato in business marketing. His goal is to help everyone discover the foundational tools within themselves using an integrative approach. Thank you, LJ, for joining us today. Now, our last two panelists. Our next panelist is Kelly Robinson, and I am just so appreciative for Kelly and all of her work that she's been leading, especially working with us as we have been navigating this COVID-19 pandemic for sure. So Kelly Robinson, who is a registered nurse and a nurse care coordinator for Westside Research, supports participants locally through the RISE Incorporated. She's also the president of Black Nurses Rock Twin Cities chapter. Kelly is an experienced registered nurse for the past 26 years. She began her career in Atlanta, Georgia, having worked in the areas of post-op orthopedics, oncology, pain management, operating room, behavioral health, and research. Thank you so much, Kelly, for joining us today. And our last panelist is Miri Sakurai, who is the Chief Family Development Officer and Health Systems Navigator at the Cultural Wellness Center, a pillar and a gem in our community. And she has been a childbirth attendant for over 30 years. And at the Cultural Wellness Center, she supports individuals who are interacting with the healthcare system. In 2013, she received her certification as a community outreach perinatal educator, and in September 2014, received another certification to be a perinatal education trainer for the Common Sense Childbirth School of Midwifery in Winter Garden, Florida. Currently, she is the co-chair of the Integrated Care for High-Risk Pregnancies Initiative. Thank you so much to our panelists who are joining us virtually today. So as a quick reminder for everyone, whether you are joining us through the WebEx platform or you're joining us on Facebook Live, please remember to send in your questions. As you are hearing folks speaking today, please use the Q&A function if you are on WebEx, and you can use the comment section on Facebook, and we are going to be looking out for your questions on both platforms. And just to let you all know, obviously, this is an important conversation to have as we are navigating a global pandemic crisis. However, issues of health and wellness in the African heritage community have always been a fixture when it comes to our policy advocacy. In so many different ways, our communities are at higher risk for having pre-existing conditions or chronic health conditions. And then also sometimes our conversations around health and public health aren't always as holistic. So we wanted to make sure we had people here at the table who are focusing on all different types of aspects of our health and wellness to have a really comprehensive conversation on the issue. So as we get started, we're going to have a section of our conversation where each panelist gets to deliver their own remarks, speaking to how their work is contributing to the holistic health and wellness of African heritage Minnesotans. They'll also be able to talk about, from their own vantage point in their work, some of the challenges they see in their work, as well as opportunities that we could be pursuing as well. And so we are going to get started. And like I said, at any point, please shoot your questions in, because after this section, we're going to have a Q&A, and then we're going to dig into some more of those awesome questions that you're going to send to us. So our first panelist that's going to be delivering some remarks is Kelly Robinson.
Thank you, Amber. Good evening, everyone who's joined us. As president of Black Nurses Rock, we collectively have made it our goal to be what is considered the trusted messenger in the community. So we're 32 members strong. We've been a chapter since January of this year, and then COVID happened. So we've been out as boots on the ground, providing masks and sanitizers and supporting food shelves and health and healing sessions, along with testing opportunities. So while working on all of that, we've been trying to find a niche for ourselves so that as Black nurses, we can be the face of the swabbers in the areas, of course, where our minorities are, because, as trusted messengers, there's a comfort that comes with having someone who looks like you. So in addition to testing, we've taken on a big hit in our senior community. Our seniors, that's our cultural backing. And too many of our elderly adults have succumbed to the effects of COVID-19. And they are also mentally suffering. And a lot of that is due to the isolation and the fear of not knowing whether you have been exposed. So Black Nurses Rock is partnered with Volunteers of America, and they've gotten a grant to support the caregivers for our elderly. And that grant will allow us as Black nurses to be that trusted messenger. So our nurses of Black Nurses Rock, they're making calls, making visits to our seniors. It is a specific program. It's for anyone that's over 60. Again, we just want to make sure that the isolation has not affected them. And, they've lost people. So keep in mind also that with family members coming in and out of their homes, it's hard for them to know whether they've been affected or not. And if we're not tested, we're actually unintentionally giving our seniors the exposure. So next week, there's actually a testing opportunity that I want to encourage everyone to participate in. It's going to be at Mount Olivet over in St. Paul. That's the 24th and 25th from 2 to 6 p.m. And it is free. So it is open to the public. You don't have to register. There'll be flyers out. And if you don't register, that's fine. You can come as a walk-up. We will accommodate both drive-ups and walkers. Black Nurses Rock will be conducting the specimen testing on Thursday. And we just want you to fill the car up, bring the babies, bring grandma, everybody in between, because we need to know our status. And so, most of you may remember back when we had the AIDS epidemic, it was the same thing, get tested so you know your status. But this is even simpler. You don't have to have a blood test. This is a nasal swab, so we encourage everyone to definitely look for those sites. So that's just a snippet of some of the things that we're working on and how we intend to be impactful in the community. Thank you all.
Thank you so much, Kelly. Next, we'll have Akhmiri.
Good afternoon, Hotep. I'm Akhmiri Sekhr-Ra. I work for the Cultural Wellness Center, and I've been with the Wellness Center since the beginning. We've been around since 1996. We're helping to unleash the power of citizens to heal themselves and to build community. And we do that through the lens of culture. And so talking with people just about their cultural heritage and how the loss of community, isolation, and the loss of culture is what makes you sick. And so that's our mission, to really work with the folks in our community to help them be able to see that the loss of community really makes you sick, especially at this point in time, really trying to help people not be isolated. And so at the Wellness Center, I am the Chief Family Development Officer, so I work with families in the community to really make sure that they're connected and that they are getting their health needs met. And looking at that, also really talking with pregnant women, pregnant families. So I am a doula. And so I've been a doula for about 30 years. I think I was probably one of the first people who looked like us who was a doula here in the communities, like the late 80s. And so really working with our families to really encourage them to be connected and to know that our babies are conscious. At this point in time, the problem that we're seeing and that we're really trying to solve as far as our families is currently 3 to 4 times as many African American Black women die in the U.S. due to pregnancy, birth, or postpartum as their white counterparts. Why are mothers and babies dying or being harmed in our system that spends billions of dollars annually on maternity care? What is the impact of institutional, structural, and systematic racism, classism, and sexism in maternal child health? All of that is things that we at the Cultural Wellness Center are really trying to address. And we're trying to address that through something that I'm started with the Common Sense Midwifery that I work with out of Florida. Is called the National Perinatal Safe Spot. And so these safe spots are just places within the community. You could be a safe spot of one. You don't necessarily have to be a group of people or organization. It's really connecting with our families, talking to our families, supporting our families, people who are pregnant, especially people who are postpartum. At this point in time, so much happens to people after when they're in postpartum. And so really just connecting with families and being with them and supporting them, just asking somebody how they're doing is a support. And so that's the kind of work that we're doing and that we're trying to do. I am started a perinatal safe spot. We'll be starting here in the fall in Minneapolis and St. Paul. So different perinatal safe spots just all around where families can come. Especially the dads too. I'm just not talking about the moms, I'm talking about the dads too, because they need to be supported in this. Our fathers bring so much to a baby's relationship, a baby's conscious, a baby's spirit. And so being able to support dads. I've also in the past, I've trained 10 men in our community here, 10 Black men who are doulas for dads. And so being able to support dads through the process, that's their job. And so if you want contact information for those men, I can give it to you. We work in unison. And I still am looking and wanting to train more people to be doulas because there's not very many people who look like us who work with our families one-on-one. And I do train people to do that work with families in a professional way, in a cultural way. So I appreciate this opportunity, just being able to speak just a little bit about what we do at the Wellness Center. You're always welcome, especially if you want to work on your own health, because you are responsible for what happens to you. And you can take care of yourself and heal yourself through your culture, through your spirit. So thank you.
Thank you so much, Akhmiri. Next, we'll have Miah.
All right. How do I get my screen to be shown so that I can show this presentation?
Shakira can give you permissions. It's like one person at a time can have permissions. So you should have it now.
Okay. All right. Great. All right. Well, hi, everybody. My name is Miah Ulysse. As Amber had introduced me, I do a lot of urban farming, food justice work in the Twin Cities. My background has been in just supporting food justice efforts across the state. particularly around how to collectively build networks so that people can amplify the work they're doing together, and also just finding ways to insert the Black voice in public policy at different levels of government. So I'm super passionate about food justice, and I will give you a little presentation about just how it intersects in the public health world. Let me get my, this is, I'm a Zoom girl, so this is definitely.
Yeah, all right now.
All right, we got it up here. So food justice and public health. I wanted to just kind of talk a little bit about the connection between food justice and public health and how food can kind of come up in these conversations. I think when we talk about public health, people tend to go towards anything that's like medical related or mental health resource related, which is absolutely true and are necessary conversations that we need to have. But I also love to have conversations around how food ties into our conversations, especially as Black people within the public health space. I think that our history is really important to consider, whether you are an American descendant of slaves, whether you are an African immigrant, someone that came up from South America or Caribbean. Like myself, my father immigrated here from Haiti when he was a teenager. And so we all have connections to food, but something that is not commonly known is that food is actually a very strong and an influential tool in colonization and in imperialism. And if you can control somebody's food supply and access to food and nutrients, it's a very easy way to weaken their immune system. It's a very easy way to control land access. And so when we think about the history of the United States and how it was formed, I think that food has to be inserted into the conversation. And even prior to then, we all have communities that we come from. We all had to eat. And so we come from hunter-gatherer communities, we come from foraging communities, we come from farming communities. And so we have the ability to use and tap into our own ancestral information and knowledge when we're having these conversations around public health. So when we look at challenges in the food space, I think a really important conversation that we have to have is how food impacts our bodies. If someone has ever heard of like a food desert before, food swamp before, it's really closely tied to where Black Americans and African immigrants have been concentrated due to redlining, due to systemic oppression from the start of this country up until even 2020, and what types of access to food there was at that given time. And that stems to the point where we have a lot of either Americans or even African Americans who have higher rates of hypertension, diabetes, heart disease, depression, anxiety, even like the connection between testing scores has to do with the food and what you put inside your body. And so we think about, access and affordability, but it's not just about the food, but it's also, the knowledge. So, how do you make sure that you're putting good food into your body? But also looking at the fact that in the early 1900s, about 14% of farmers identified as Black. And to this day, nationally in the United States, we have less than 1% of farmers that identify as Black just because of the access to land and the capital. A lot of farmers that lost their land. If you've ever heard of the term 40 acres and a mule, that ties into the fact that there were Black farmers that were freed from slavery and were promised 40 acres and a mule as a part of homesteading. And a majority of those farmers actually were not given those land. And so when we think about generational trauma from oppressive policies, that starts from the very beginning. And we're not just talking about 2020 and access to land and going up to the legislature and advocating for ourselves as Black farmers, but it goes back to the very beginning. And a number of people who in their history, in their family history, have trauma around their great-grandparents telling them stories of being promised land that was never given to them, having to fight for land on a consistent basis. And then that feeds down into how we can feed our families, the access to the types of grocery stores that are in our communities, and then leaving it up to chains and corporations like Cub Foods and Aldi and Walmart to be able to supply our communities with quality food, which if you've been to the Cub Foods on the north side, their quality produce is very different from the quality produce that is over in Edina. And then when you think about the perception of healthy foods, I've heard even like friends and families are like, oh, that's white people food, or the stigmas around eating healthy and like the types of food that you put in your body can be a barrier and a challenge when we think about how we as Black people can nourish our food into our bodies. But what I want to talk about today is just kind of like the lack of culturally specific mental health resources. Myself, it took me 7 years to find a Black queer therapist in the Twin Cities, like 7 years, y'all. It was tight. And so I think about food and the way that we heal our bodies. I think about the lack of access to culturally specific mental health resources, the lack of access to healthcare. Sometimes even, you'll find a therapist and they won't take health insurance for a variety of acceptable reasons, but it can still pose a barrier for people. And then also just the stigma within different communities that fall under the Black diaspora around mental health resources. And so even like the term like culturally relevant, it goes into just how people want to be held within that space to be able to provide support for them. And so I want to just talk very briefly about an initiative that I'm working on called Community. It's an operation that was started in June of 2020 and was actually started by myself and 3 other Black women. And it was in response to the murder of George Floyd. I remember just everything, shut down. There was rioting everywhere. People were protesting. People were exhausted. Myself and other organizer friends included were just up all night long. And so we were thinking about how we could support our community in a very intentional way and in a way that didn't require the exchange of resources where you had to pay in order to get our services or you had to pay in order to get a return. And we thought about our role that we've had in the community as organizers, as urban farmers, as herbalists. And we founded an initiative called Community, which provides free herbal and medicinal tea blends specifically to the Black community and those who identify as Black at absolutely no cost. We did a great deal of fundraising for about 3 weeks and were able to get some donations of herbal ingredients, and we're able to kind of start our process of developing our product. And when we talk about herbalism, it's the use of plant medicine and things that you could step on a weed when you're going on a walk, and that actually could be a medicinal herb that has been used as a part of our community. And majority of communities across the Black diaspora have a very strong history of using plants in varying ways of curing issues in their body, healing ailments, healing themselves from sickness. And so we wanted to make sure that we're bringing that element into the space because we see a lot of people who are exhausting themselves, fighting for justice, but are not either able to financially or mental space to take care of themselves. And we firmly believe that plant medicine can be a really approachable way for people to take care of themselves. And so we created 2 different blends. We created a dream tea and an immunity. The dream tea was created just for people who have anxiety, who have sleep deprivation or insomnia, people who are staying up all night guarding their communities, and were having a hard time shutting their brain off. And so we have a variety of herbs that were included in that blend, like valerian root, catnip, peppermint, to just kind of soothe your body and to kind of help your brain relax so that you can actually get to bed and be restful. And then we created the immunity blend, which has flowers like calendula and yarrow flower, and is just a really beautiful and vibrant blend to help people sustain themselves, to build resiliency within your immune system, especially since COVID is going on right now still, amongst all of this police brutality and people's sustained fight for justice. We really felt like these 2 different remedies were resonating with us when we created this product. And so this is an example of, we have a brochure, we've done a few distributions so far in the summer, and we have another one that's coming up on Saturday. And we actually have a brochure that we give to people because it's not just freebie, you're going to, a trade show or a conference or you're in a community event, and people are just handing out popsicles and pens and things like that. We really want to sit with people and talk to them about the teas. We want to answer questions that they might have. We've had some pregnant folks come by and ask about, if this is going to impact their body or influence their pregnancy. People who have shared with us, the struggles that they've been going through with getting to bed. And so we really want to be a resource. And so we created a brochure so that people could know exactly what's in these blends, knowing that they can actually find these ingredients pretty easily within the Twin Cities and they can make it themselves, because we want it to be accessible. Again, like, we're not here to like pilot this huge business and to capitalize off of Black trauma and pain, but we want to offer it to Black people specifically and let them know that this is a product that they can use when they're feeling stressed, when they're feeling weak, and that they're valuable and that we deserve to have beautiful things that make our bodies feel good. And so we had a distribution on the north side early August, and then we had a second distribution at the Black State Fair, where we had partnered and had a table with the Minnesota Healing Justice Network, and we're able to give out some hot samples, of course, like, making sure that things are sanitized. And then we will have an upcoming distribution on Saturday, which we are having on our own, and it will give people a chance to just try out foraging and learn that there are so many herbs around them, even when they're walking around the lake, that are really accessible. And so getting people comfortable with even 4 or 5 different plants that they can identify in the future for themselves and learn how to harvest them. And so I will copy in the link just so that people have it. And if they'd like to join, they sure can. So I'm going to stop sharing my screen. And I just wanted to quickly show people, I just think it's really beautiful. And so I just love that there's so many colors, and there's like hibiscus in here. And this is our immunity blend. And when you steep it, it turns this really beautiful, like red ruby color. So I'm done talking, but yes.
Thank you so much, Mia. And we shared the link in the chat and on Facebook. Please, if you, I'm thinking about going. It's at Lake Phelan, right? So get to be near some water as well, and get to learn really important information about herbal medicine and try some teas. So thank you, Mia. And then our last panelist before we go into Q&A is LJ.
Peace. I got excited about the tea stuff. I love tea and medicine, herbal and holistic health. And so, again, my name is LJ. I currently work at Kente Circle. Actually, my father's business he created with Bill Rozier about 16 years ago. And as a mental health practitioner, I think something that I've been noticing while in the field is that people are beginning to open up about their mental health and about their health in general, which is exciting to hear. And there's been a lot of skepticism for very valid reasons in our community, especially when dealing with healthcare systems. And so I think my job primarily is to create trusting relationships and encourage those that I'm working with to overcome, trauma, fear, trauma that wasn't created by us, but that we're experiencing now. Something that I like to implement in my practice is the spiritual and physical healing as well. And so while I think it's important that we're talking about a lot of what we're experiencing, I think the why and the action behind it also is just equally as important. And so I like to bring up, what are you eating? What is how are you sleeping? Are you outdoors in nature? Or are you indoors all day? I think that's just as important as the tough conversations that we're having. Some of the challenges that I've been having, or that we've been having, is this transition to technology and being virtual and online for multiple hours a day. I think it's been a beautiful thing that we have this technology that we can stay in contact with the people that we're working with in our community, but also it blocks a barrier to the physical connection between us that can't be replaced through technology. I think the biggest challenge, though, is the lack of access for our community on both sides, for our clients and also for practitioners. For practitioners, it's a limited amount of us, and there's so many people within the Twin Cities alone who are searching for people who look like them, from Black folks to other brown bodies, and so that's definitely been a barrier. But then also access to funding for clients to come in, and a limited access within their own insurance companies. And so that's another barrier we've had is with people losing jobs during COVID, and also being connected to the insurance that they were receiving through their employer. I personally lost a couple clients, but also have found a few loophole ways to stay in contact with them and point them in the right direction, even if they couldn't stay with me. So that's another obstacle that we faced, and also another a solution that I think that I have been personally working on is I do a lot of work with youth, and that kind of halted when COVID hit, because it was going to schools or going to juvenile detention centers and meeting with them personally, and not being able to do that because of risk of spreading COVID and people being in and out. Has been a huge challenge for the youth, especially not being able to see family as much as they would like to, but then also us not being able to go in there and see them as well, and being able to continue the relationship work that we have been building for multiple years, and stuff like that. And so that's been disheartening to have to experience lately. Another thing that I had also wanted to talk about was some of the work that I hope myself and community can do post COVID, but also in the process of planning and being able to implement some things that actually saying with getting back to nature and looking at our health from a aspect other than just mental health, but also what are the foods that we're eating, how we've been in contact with each other, and even when we're doing donations and volunteer, that we're not, giving out bags of McDonald's, but that we're teaching our youth and our community members about healthy eating, and also how to grow our own foods as well. I think that's important, especially with the changes in the FDI. With all of the regulations that are happening. So educating ourselves, I'm continuing to educate myself on the foods that I'm eating, and also wanting to spread that information to the people that I'm working with and implementing it into the practice that I do. And so that's a little bit about what I do and some of the work that I'm involved in.
Thank you so much, LJ, and thank you to our panelists for your opening remarks. A lot of great and exciting work that is happening in our communities that we need to be supporting, as well as uplifting when it comes to our holistic health and wellness. So thank you so much for your time and at this moment. So we're going to segue into our question and answer section. And once again, just want to put another plug in. If you're joining us via the WebEx platform, if you're joining us via Facebook Live, please comment with your questions, and we will include them as part of this discussion. And so how it's going to go is that I'm going to turn it over to our Vice Chair for the Council, Wayne Doe, who is going to deliver some pre-written questions to each of our panelists just to get the conversation started. And then we will incorporate any audience questions to further the conversation before we move on to our closing. So I'm going to turn it over to Councilmember Doe. Thank
you again, Amber. So let's go right into the questions. I think the information so far has been great. If you're not excited, I'm sure you will be by listening to more of what's coming. So I'm going to start the questioning with Akhmiri. Let's start with you, okay?
All right.
Okay, thanks. Well, given your experience in maternal and perinatal health care and advocacy, what are some opportunities the state of Minnesota can support to expand access for parents to options like doulas, and that can ensure affordability for parents while also ensuring funding for practitioners?
Yes, definitely. That's a great question. At this point in time, there has been legislation that has come through that is about third-party doula reimbursement. And so doulas are reimbursed through some healthcare, depending on um, people's NPI number. If they have one, they can get reimbursed through third-party reimbursement, which is insurance. But at this point in time, it's not enough money. It's not like a living wage for people to do. And what they funded is only for like from 6 to 8 visits. And I know I personally, I like to meet my moms early and see them often. And even afterward, postpartum, I end up seeing people 10, maybe 15 times over a 12-month period. And so it's not enough dollars. It ends up being maybe $700. And so I think um, we as a community can talk this up, talk about this being something that's being detrimental as far as to our maternal and infant mortality. It's what's affecting it by not being able to see somebody who looks like you, who can support you through the process. Even at this point in time, even though some of the hospitals still aren't allowing people in or just 1 or 2 people in, you can help people virtually. And so being present, being there for them, talking with them. And so I think that is a way that the community can just start asking questions of their council members, of their senator. Um, just what are you doing as far as healthcare for our babies?
Thank you. We certainly got a role to play with that. The next question goes to Kelly. Kelly, from your vantage point as a nurse and an advocate, as we continue to navigate the COVID-19 pandemic, tell us how can both the state of Minnesota and community partners work together to lower the disproportionate positive case rates in African heritage communities?
Thank you, Wayne. So from the state's perspective, you and Amber know that and the council, we've been working with Governor Walz over the past, I guess, 4 or 5 months. We've had about 3 meetings where I've leveraged some of the issues regarding access and testing and all of the things that were of the primary concern that I had received from my peers that are on the front lines, as well as community folks when we're out servicing in minority environments. From the state's perspective, they've increased the testing in June, and we're talking COVID-19 testing. They increased the testing in the Twin Cities, more over north. A couple in St. Paul. This was back in June when we were able to widely test, because mind you, the testing was limited across the country. And so our ability to do it quickly was, stifled by those challenges. So I was able to observe this setup initially in June. I went to New Salem over north. That was a walk-up setting. And then I went to the Jimmy Lee setting, which was a drive-through. I was disappointed because in their efforts to provide that access in the neighborhood, looking down, it sounds good. It's like, wow, they're over north, in addition to North Point and some of the other smaller clinics like Fremont and those, they are still in the community, but the area is so vast that at New Salem, if you lived, let's say, at Lowry and 4th, that's a long way for someone to walk to get to that actual free testing site. So there were challenges with regards to the frequency and the placement of those testing sites. So I was a little disappointed in that. And then in St. Paul with Jimmy Lee, I went over, it was a drive-up setting. It was right in the Rondo area, which is heavily populated with the underserved minority community, but it was drive-through. So on paper, it looked good because it's like, wow, they're in St. Paul, you know? But if you didn't have a car, you couldn't get tested. And so even though the presence was there, they were still, you know, unfortunately, the community could not take part in that testing if they did not have a vehicle. So I'm excited now because in our efforts to leverage our concerns with the council through the governor and, you know, sharing those insights and working with teams both in Ramsey County and in Hennepin County, I've been able to impart that we can be the change. You know, Black nurses, we're here, you know, we will do those off times and those off places and what it takes to test our people. And so now you'll find like a week ago. Yeah, a week ago, I was over at Shiloh Temple over north, and they had both. They had the drive-through and the walk-up. Now, actually, I was upset with the state because they didn't provide the access like I thought they should in terms of the drive-through and the walk-up. So now they're doing it. Now I'm upset with the community because they're not showing up, you know? And so from the community's perspective, you know, I've worked with a lot of grassroots organizations and, you know, they have great intentions, you know, the immediate needs that we had after the unrest and, you know, they've been calling us and we've been there. You know, now at this point, it is that Black Nurses Rock will again be the trusted messenger from the community aspect to pull our people in. You know, it's like we've got to get tested. You know, we've got to show up and we're going to come to your neighborhood. And I hope that in the next few months, while things are still, you know, hot, that we're able to do some off times. Like next week, it's Thursday and Friday, but it's 2 to 6. You know, what about the people that work in the evening? What about the people that have the weekend free? You know, because there are all of those options. So hopefully we'll be able to bridge that gap in the future by assisting with the testing with the state and accessing the community to these organizers. It'll allow that time frame and that free option because all of this is free. The testing is. So there should be no reason why we can't get tested and know our status. So it's a little bit.
Great. I think your work is actually paying off, and that's great. I know I listened to partly a news conference today, so it looks like there's some new testing initiatives that's going out. Mm-hmm. So I think probably that will also help, you know, in terms of the work that you do. Thanks so much. Thank you so much.
Yes.
Larry, the next question is for you. How can government entities like the state of Minnesota contribute to dismantling barriers to accessing mental health care in the African heritage community, particularly in the wake of the civil unrest our communities have experienced this year?
Yeah, Pete, thank you for the question. I think the first thing is we need to take a look at all of the systems that are harming intentionally and unintentionally communities of color, and not just police departments, but any system that is impacting us. And I think we need to make sure that we're allocating funds and resources to communities that can afford a therapist, that cannot, you know, afford the essential, just the essentials, so food and housing and those things. And I think we need to focus on our youth as well, as they are the, you know, these are our people for tomorrow, and give them the proper resources that they need. And so I think the first thing is reallocating the funds. is what I think is what needs to happen.
Okay, thank you so much, Larry.
Thank you.
All right. So last but definitely not the least, this question is for you. What programs, Miah, or initiatives can the state of Minnesota fund and or support to increase access to quality and fresh foods in predominantly African heritage communities?
Yeah, there are a number of programs and policy opportunities. I think that the first one that obviously comes to the top of my head is continuing funding for the Urban Agricultural Grant Program. These are funds that can be utilized to hire staff, can be used to, retain equipment for urban agriculture efforts. And it's something that has been going on for the last 3 years. And we've had increase in funding each legislative session and continued funding. I think we'll have funding up until about 2022, which is great. But when we look at still across just Minnesota alone, over 99% of Minnesotan farmers identify as white. And so literally that 1%, remains that covers everybody that would identify not as white. And when we look at the fact that the population of Minnesota is about 22% who identify as BIPOC, that, that ratio is severely off. And so I also like to say that the Urban Agriculture Grant Program is great, but it doesn't fix everything. It doesn't allow you to procure and purchase land with the funding. And so if you don't have access to land, which is the first step, an initial, necessity that you need in order to start growing, then you're not going to be able to actually utilize the equipment or the staff time that you use to further your own farming operation. And so that's a big gap that I think the Department of Agriculture could work on, is being very intentional about connecting Black, Indigenous people of color to arable farming land at free or low cost, and finding ways to make it approachable with a very explicit racial equity lens. In terms of herbalism, I'd always love to see herbalism come up at the Capitol, just because it makes me think about even doula services and non-Americanized or non-Westernized ways that people of color support each other health-wise, mentally, physically, that aren't generally covered through health insurance. And I'd love to see herbalism being covered so that people who practice herbalism can actually be compensated through a medical lens. Let's see what else. There are a number of ways. I think finding access to capital for grocery stores to open and stay open is extremely difficult. And that's not just in the Twin Cities, but it's across the state of Minnesota. There are a number of grocery stores, especially small grocery stores, that have closed and shut down in the last 5 years. I remember I was hired to project manage for Worth Co-op Grocery, which was a co-op that was looking to serve the north side, that was started on the north side, and it took about 10 years for us to finally get up the operations, the capital, and to be able to pay staff to open up the store. And the store, I didn't run the store, unfortunately, but the store only lasted about 10 months because it couldn't financially make it in the grocery industry, which is very hard. You have very thin margins, and it can be very hard to support yourself financially until you get to that point where you can, it's called the break-even point, but until you can financially sustain yourself. And so I'd love to see the state of Minnesota and the legislature taking a more aggressive approach on how to keep small community-owned grocery stores open, and not just Cub Foods and Aldi and Walmart and larger chain-based grocery stores that have the capital and resources to be able to open new operations and take over those small community-led grocery stores, because that's generally what happens. So it's always a shame to see a grocery store closing because they can't make it in an industry that is not meant for smaller scaled grocers. So those are kind of I think those are the three main pieces that come off the top of my head.
Thank you. And those are very, very, very important for us to move forward in that regard. So let's see, where are we at with community questions, Amber?
Yes, thank you, Vice Chair Doe. Please continue to share some questions for our panelists. I have some questions to follow up on some of the points that were shared by our panelists. And so I'm going to turn it over to Kelly to kind of talk a little bit more about how we as a community can continue to navigate this pandemic and making sure that we're, taking care of ourselves and our health. And so we are going into the fall, which means that, cold and flu season is among us. And so how are we to navigate these next, particularly, 6-ish months through cold and flu season? But, we're starting to get more information out from like WHO and the CDC and all these places about just the life cycle of how this pandemic will be from now until widespread access to a vaccine. And so it looks like we are going to have to really be prepared for the long haul. And so how should we navigate these next 6 to 12 months, particularly as we're going to cold and flu season? And as we know, there are a lot of similarities in the symptoms for the coronavirus versus having the common cold versus having the flu. So that can be really challenging, and want to ensure that we can navigate the healthcare system effectively. But also, how can we decipher accurate information about COVID? We've been having a lot of conversation, you said, about testing, making sure we're accessing, testing when it's available. But also we've been hearing a lot about, okay, when you should go get tested. Now they don't want you to go get tested if you're not showing any symptoms, but you may have been exposed or you've traveled, things of that nature. A lot of conversation about the vaccine and the trial process is going on right now. And we can continue to talk about like how we can strengthen our immune system as well. And so from your perspective, as a nurse, as a healthcare practitioner, like how can we as folks in the African heritage communities, like decipher accurate information? Because I think it's just been very difficult navigating kind of the media storm around this. And at the end of the day, COVID is disproportionately affecting our people. So we need to make sure we are equipping ourselves with accurate information to protect our communities, right? So how do we do that? From your perspective?
Emma, that's a mouthful, girl. So first, let me say this. COVID is real. You either know somebody that knows somebody that's been affected, whether they were sick or whether they passed away. So facts, it's real. And we have so many unknown factors. But what we do know is that we need to know our status. We need to know if we have any of the antibodies, if we've been exposed. We've had that conversation around people who have been exposed, but they're not symptomatic. The state is providing testing. Go get the test. Then you know. And once you know, continue to protect yourself, because this is going absolutely nowhere anytime soon. There's so many things that we don't know about it. And those who've been exposed, there's an unknown factor there because there are risks. So the biggest piece with all of this is flu season is coming and flu shots are out there. Get the flu shot. People have had their opinion regarding the flu shot. Should I take it? Should I not? This is a good time to take it. I can't imagine having the flu and COVID together. We've already been heavily affected with just COVID. So to have both, I'm saddened, because when they project those numbers, we all know they say them, and here we are, hitting 200,000. We were like 150,000, a month ago? So it's moving fast. We have no control over it other than to protect ourselves with wearing the mask. And even though it's a simple covering, it's an awareness and it's a barrier, you know? So I think most of us who are simple enough to understand that you cannot control the virus, do what you can to support yourselves, you know? And so that's why we've been out here passing out masks, handing out sanitizer. You know, when you think about it, water is key. Whenever you're near water, wash your hands. If you're not near water, then use the sanitizer. Because some people have been using the sanitizer at the house. It's like, no, use soap and water at the house. Use the sanitizer when you can't get to the water. But you will hear soon, there are free flu shot clinics that are popping up. We typically start that in October, but we started a little bit earlier in some places. And if I'm not mistaken, I think Manal one last week. So you'll start to hear that. I'd like to encourage folks to go to our page, our Facebook page, because we're going to try to make sure that we have that as a trusted site where people could go, okay, where's testing? Black Nurses Rock Twin Cities, okay? Because there's a national chapter, but we want to make sure you get the local information. That's going to also share with you where the testing sites are. I'm sorry, not testing sites, but where the flu shot sites are. Because my thing is, get that flu shot so you at least have some barrier from one aspect of the virus that we're in now. So the other is get tested where you can for COVID so that you know your status, because the unknown is what's getting us. You know, I feel good does not work. Okay. Because I feel good means you could have been exposed to the virus, but have no symptoms. So I feel good does not work with this. Testing for confirmation is what works. So I hope that helps, you know, in that sense. You know, I'm saddened that we cannot rely on everything that comes out of the CDC at this point. We have to use our own logic, you know, to a certain degree. And we do have some trusted messengers regarding Dr. Fauci. And then we have the naysayers, but we're all intuitive enough and we've been affected. And so we know that our population is very vulnerable to every aspect of this. So, you know, the old saying is when the world gets a cold, we get the flu. Well, when the world gets COVID, we die. And that's real. So let's do what we can, wearing the mask, using the sanitizers, getting tested so that you know what your status is, and get that flu shot. That flu shot's going to make a difference. They're at all of the clinics, you know, CVS, Target, your doctor when you go. Everybody's going to be pushing it because we know that that's another barrier that we can do now. You know, vaccine, another huge issue. Science is important. Let's let them test that thing. You know, let's give them the time. It's going to be next year before it's available to us, but let's let them test it because the unknown factors. But those key things are what I would suggest in terms of where we go from here with providing safety against COVID.
Thank you, Kelly. Thank you, because you know it can be difficult, like trying to figure out what's real and what's not real. So thank you for that. I appreciate that.
You're welcome.
I have a follow-up question for Akhmiri, and just wanted to talk a little bit more about Black maternal health in particular. And there are a lot of there's a lot of data that's showing that we are more disproportionately affected. Black mothers are more disproportionately affected during the pregnancy, the birth, the postpartum process for complications or near fail, or actually, you know, fatalities, or the babies themselves can develop different issues and things like that. And we already know that some birth is a beautiful process, and it's also it can be a dangerous process as well if it's not done properly. And so can you talk a little bit more about how the presence of someone like a doula or midwife, just having that other advocate during the pregnancy process, both pre and post birth, can help to decrease that, particularly since this is becoming a larger policy issue. And so how are we thinking about how expanding these services can really help to address those disproportionalities?
Oh my goodness. Having a doula is really a opportunity to have somebody who knows a lot about birth, who loves birth, and who loves birth, and being able to support somebody through the process. I personally like to meet with people early on, even the first trimester. You get to know someone, you learn what makes them scared, how you can support them through that, and then provide education. So you build a bond with somebody over the months as they grow and as they change, and being able to talk to them, being able to have a conversation with them. It's so important, and it makes a big difference to have that extra support. They talk about how even a woman can be in labor by herself, and she might just have another woman just sitting in the corner, not even really talking to her, but she feels supported. So it's important, and especially important to have somebody who looks like you, who can kind of relate to your experience and be able to hear. All doulas are different, and I always tell people when they interview me, I say you can interview somebody else too. You might not like my vibe, but I might be able to find somebody who does like, who you can get along with, just to be able to talk to and have them really be able to hear and support you, and also to be able to talk to the dads too, because they have many questions. And sometimes if it's a first time dad, he doesn't know what he's in for. And so being able to talk to him, have him be supported, and have him be able to ask all the questions he wants to ask too. And so it's important to have that extra support and be an advocate. Really being able to teach somebody how to advocate for themselves is what's really important. And I think that's what doulas, childbirth educators, that's what they do, and midwives.
Great. I have a quick follow-up question from someone to me. Are doulas expensive? What's the true cost of a doula?
It can vary. At this point in time, the going rate is, I think it's five something maybe. It starts out between from 5 to 1,000, depending on what you want and what you get, because there are doulas who do other things too, placenta encapsulation, which is a whole story in itself, massage, herb work. And so there's other things that doulas can do along with what they provide. I know for myself, I do a kind of a sliding fee scale. I've been talked about for many years for doing that, but for me, it's about reciprocity. And so if somebody can't pay me, help another family, help another woman, help another couple later in your life. Give back to your community. That's what it's for me. But I just do a stipend, pay for my parking. I like jewelry. I like fabric, things like that. So it's about reciprocity. But doulas, it can vary. The price can vary. And so it's a conversation that you can have with somebody.
Yeah, I like what you did there with the bartering system. They're like, what can I give? Thank you so much, Miri. We probably have time for maybe one more question. I'm gonna kick this one over to LJ. And so I just wanted to bring up, you say you've been doing a lot of work with young people in particular, and noticing some of the changes that have been happening due to the pandemic. And one of the conversations we had early on in the pandemic was really about how young people have been experiencing this pandemic, whether, like you said, through the social isolation, the disruption in their school and work environments. And then there were certain things that happened as it was getting warmer. They took down the basketball rims and things of that nature. I think a lot of us recognize that young people were definitely going through a lot. And trying to figure out how to support these young people in particular, because this pandemic is not going away. We still have to socially distance, still have to be healthy in the ways that we are navigating this. But still, it's still a challenge. And so speaking to that a little bit more directly, like as I was saying with Kelly, we're still going to be in this pandemic for probably the next year or so. So how can we support our young people in this time?
Yeah. I think thanks for that question. Actually, I think something that we can do that all of us have the capability of doing is reaching out, and so having that one-on-one relationship with someone that we already have a connection to. I know there's from the years of working in JDC, when the young man got out, I reached out and gave my contact information, and so a couple of them still reach out, and I may go drop off a meal to them, or may have a conversation and walk around the lake or something, and do that one-on-one stuff where we're still practicing physical distance, and we're still being conscious of like the current situation that we're in, but we're not taking away from the humanity of who we are. We're still relational beings. We can't totally isolate ourselves, but with the current situation, we have to be careful with how we're moving. And so I think something that I've been doing is being intentional about like for families who have a lot of people in their family, go do a camping trip. You guys are already in the house together. Go do something, plan something out. Rent an RV and go up north Minnesota and spend some time together outdoors. Take it outside. If you at first I was advocating for doing like book clubs or little tea parties or whatever over Zoom, but I think people are a little zoomed out right now. So doing also outdoor events, tossing the ball around, shooting around, going to the park or something, but doing it in short numbers and not putting yourself at risk. And continue to have conversations, be real about what you're actually experiencing and feeling, and talk about some of the things, and not just ignore what's actually happening. And so I think that's something that we tend to do, especially younger generation. If I just ask them how they're doing, they say I'm straight, I'm good, but I ask 3, 4, 5 more times, and then they tell me what's really going on. And so I think just normalizing that we're all in this experience, and that we may not have a solution right now, but that we're not the only ones experiencing it solo, and that you got people who are also going through it with you, has made it a little easier, from my opinion, and from my experience of hearing what the youth have to say.
Great. Thank you so much for that, LJ. We have to make sure that we are staying close to our young people, staying close to our elders as well, because like this is hitting them both on different sides of life, of the life cycle. So I just thank you. And I thank you all for just sharing your wisdom with us this afternoon. And as we close out, I always like to do a last closing remark and send off. So this is just like a 1-minute space for you to just share some words of encouragement or inspiration from wherever you're situated, or just some last words that you want to impart on us. And so we're going to go back to LJ to share his last words.
Yeah, I think I would say staying optimistic is something that I'm always believing in. Is that stay optimistic and do creative things. Use our brain, use our body, and do as many possible things to stay healthy. Make something. I have a lot of friends that like to make music, and so in this time especially, I'm encouraging them to share what they've been making, so that they stay motivated in making those things. I've tried to do some arts and crafts stuff myself. I wasn't into that, but now I'm making little bracelets, giving them out to some of my friends have kids, and so I give them to them and stuff like that. Just the little things in life that we ignore, that can make ourselves and other people around us happy. Yeah.
Thank you. Thank you so much. I do also have a lot of friends that make music too. So that's been fun. Akhmiri, you can give your last words for us tonight.
Giving birth is a powerful, magical time in a woman's life, a creative, life-affirming, and life-giving experience. which finds expression in the diversity of ways that are right for that woman and baby. It is a time of great transformation when you're growing and maturing, not only in your body, but also in your heart and mind. I honor childbirth as a rite of passage, a celebration of life. Hotep.
Thank you, Hotep. Thank you so much. Kelly.
Don't let your guard down. Stay protected. Know that we will get through this and it won't be forever. But right now, let's make the sacrifice and stay protected. So keep your guard up, mask up, and we'll be all right.
Thank you for that cautionary reminder. Stay up. It still hasn't left us. And then last but not least, Miah.
I got two things. First of all, just a reminder that what you put in your body influences your immune system. And so I know from personal experience that it might be just super easy, to eat all of like the luscious, fatty, fried, smothered things that make you feel kind of good inside when you're not feeling at your greatest. But this is definitely the time for us to reconsider what we put in our bodies because, COVID is still here, like Kelly said, and it will help us to be able to build our resilience if we have strong immune systems based off of the food we put in our body. And then the second thing is just, find, if you're not actively engaged in your community, find a way for you to connect. There's always a way for you to use your skills and your passion. And I think people would be surprised on how they can plug in. And it's not always about protesting or being the loudest person or the most woke on social media, but everybody has a skill they can contribute. And so just to, consider how you can tap in based off of, where you feel like it would be useful in the movement.
Thank you so much, Miah. And I just want to say, complete sidebar, but this piece around the food is so important. I think particularly in this pandemic, while we're much more sedentary and we're at home, I've struggled a lot with energy. My body has felt very not energized, and a lot of it was because of food and movement and just making those changes and becoming more thoughtful about what I'm eating, even on days where I'm not moving my body, and drinking water and things of that nature. It makes the difference. And we're about to go into hibernation, Minnesotans, okay? So remember, you're like, dang, it's about to get cold again. And that also affects things. So we have to stay on top of our nutrition for real and our exercise as well. So just thank you so much for your work and that reminder. So I want to say thank you, everybody. Thank you to all of our panelists. Thank you to Councilmember Joe. Thank you to the council staff, to Shakira, to Jasmine. And thank you to all of our panelists who have participated this summer, and to our participants who came in to be part of the conversation. This has been a really exciting program that we have ran this summer, and we're excited to go into the fall to talk more about how we can translate these issues to movement at the Capitol. So I just want to close with a couple of announcements. One announcement that I have is about our upcoming workshop. We are going into, we're already here, really. We are in a season of civic engagement, of getting ready for election season. We're here, and there are less than 50 days until Election Day, and the council wants to make sure that we are providing critical information to you about how to vote in this time during a pandemic, and make sure you can do it safely. Make sure that you know how to vote by mail, how to vote early, how to vote from home, how to vote safely in person, whether you want to go in before Election Day or on Election Day. And then also the appeal to be an incumbent elections judge, which in this pandemic is very important because typically a lot of election judges are our elders. A lot of our longtime election judges are our elders. And so for those of us who are a little bit younger, we want to think about how we can serve to make sure that our vote is protected and that it's counted. So we are hosting a voter engagement workshop with the Secretary of State's office. This is going to be on Thursday, October 1st at 12 to 1:30. We're going to be back online via webinar and Facebook Live. We're excited to have our Secretary of State, Steve Simon, join us, as well as Nasser Musa, who is their voter outreach director. And he is also a former chair for the Council for Minnesotans of African Heritage, as well as Michael Wall, their voter outreach specialist. And so this is going to be a lot of fun. And this is information straight from the source, okay? This is the office that administers elections across the state, working with the local and county offices as well. And so get the information straight from the source. What does it mean to vote by mail? How can you track your ballot? How to register, how to request a ballot, all of these things. And just to give a really quick reminder for you all, early voting starts tomorrow. Hey! So you can start to vote early tomorrow. You can go to a county elections office tomorrow and vote. You can register to vote online and request your ballot, and they will start mailing them out tomorrow. And so let's make sure that our people are getting out to vote in this election. So I had to make my passionate appeal to the people for this season of elections, so we can make sure that the pandemic doesn't keep us away from the polls, okay? In addition, our next upcoming council meetings, so we have monthly council meetings where we discuss the business of the council, as well as invite special guests throughout the state enterprise system. We've hosted a lot of commissioners of various departments throughout this past about 5 to 6 months, and it's been really great, really important conversations that we have. And so our next meeting is October 13th. That is at 6 p.m. You can watch that on Facebook. You can also RSVP to participate in the public comment section. And so if you want to learn more about the council's work, that is a great space to also join us as well. And then I also wanted to make sure I gave an opportunity for, so we had a lot of different events and things that were plugged during this session. And so just a quick reminder that the community plant walk is this Saturday. We posted the links on the chat functions and also on Facebook as well. Go check that out. There is testing at Mount Olivet Baptist Church in St. Paul. What were those dates again next week, Kelly?
That's Thursday from 2 to 6 p.m. and Friday, 2 to 6 p.m. No registration is required, but the flyers will go out and you can register at those hours.
All right. So make sure you get tested. I make sure I get tested whenever I may be traveling, or I know I've been around a lot of people and I want to just make sure my sanity is secure, that I don't have the coronavirus. So please don't be afraid to go get tested when you need to go get tested. So I just want to thank you all again for joining us for our Conversations with the Council series and our Public Health Roundtable discussion. You all have a great evening. Stay up, stay safe, stay on guard, and stay, in love with each other. Thank you all so much. Have a great evening.